Contraceptives. Hormonal and non-hormonal birth controls. There's the hormonal birth control would be birth control that prevents ovulation from happening. So some examples of hormonal birth control would be the combination pill, the mini pill, the hormonal IUD, or the arm implant. Non-hormonal birth control would be like condoms, spermicide, the copper IUD. First, I want to talk about the pill. It is 91% effective with typical use. There's a combination pill and a mini pill. The combination pill uses two kinds of hormones, estrogen and progesterone. The mini pill only has progestin in it, which means you might have breakthrough bleeding. Both pills are equally as effective. The pill is taken once a day at the same time for it to be most effective. Male condoms, 85% effective with typical use. That does take into factor when they break. A condom is a thin covering, usually latex, worn over the penis during sex. When the penis ejaculates, the sperm stays in the condom, so it can't fertilize the egg. Condoms are available at any drugstore or supermarket. The huge benefit to condoms is that they also prevent STDs and STIs. The IUD, over 99% effective. The IUD is an intrauterine device, a small T-shaped plastic device that is placed inside the uterus, and it releases hormones. There's also a copper IUD that doesn't use hormones, so a lot of times if someone is having a lot of different side effects from birth controls, a non-hormonal, the copper IUD is a great route to go. Once the IUD is in, you do not have to get, you don't have to deal with anything for the next 5 to 7 years, which is hormonal, and then the copper is up to 12 years. The depot shot, 94% effective. The depot shot is given every 3 months to prevent pregnancy. The injection contains progestin to prevent ovulation, so there's no egg for the sperm to fertilize, which also makes the cervical mucus thicker, so the sperm has a harder time getting through. Spermicide is 72% effective, a chemical usually in a cream base that kills sperm. It can be inserted vaginally or used with a number of different birth controls to kind of double up. So you could use it with condoms, or you could use spermicide with like a cervical cap. The patch is 91% effective. The birth control patch is an adhesive square placed over the subcutaneous tissue. So that would be like backs of the arms, the stomach, and it has progestin in it and estrogen, so it has two kinds of hormones, and it is worn for about a week and replaced with a new one in a different spot. The female condom is 79% effective. The female condom is very similar to the male condom, but it is worn on the inside of the vagina. Just like the male condom, it prevents sperm from being able to go into the cervix. Female condoms are a little bit harder to find, but you can buy them online or at any Planned Parenthood. The arm implant is 99% effective. The birth control arm implant is a very small rod that releases progestin over the span of 4 years. Just like many other birth control, it prevents ovulation from happening and makes the cervical mucus thicker. The vaginal ring is 91% effective. A vaginal ring is a small, flexible ring inserted into the vagina that stays there for up to 30 days and releases estrogen and progesterone. Your provider can prescribe the ring for you. A diaphragm is 96% effective. It's a small silicone cup that covers the cervix to prevent sperm from going in through the cervix. It is also commonly used as spermicide, and you can talk to your doctor to get one just because you want to make sure that which one you get fits perfectly for you. And if you have any questions about any of these birth controls, be sure to ask your provider. They'll be happy to answer any of these questions and find which birth control is perfect for you.